Starting up again with our first panel on California laws to restrict the sale of flavored tobacco products, the tobacco industry referendum, and impact on community health. So we have Jim Knox, Valerie Yeager, and Bonnie Halpern Felsher.
Good morning, everybody, and welcome back from your stretch or your bio break. My name is Jim Knox. I'm the Managing Director for California and Hawaii for the American Cancer Society Cancer Action Network, which is the advocacy affiliate of the American Cancer Society. I want to thank you for the opportunity to be with you here today and the pleasure of being on a panel with two of my favorite tobacco warriors. My job this morning is to provide the history and status of California's law to prohibit the sale of flavored tobacco, a subject which I believe has emerged as the next and most impactful policy front in the war against tobacco. So, flavored tobacco has been used for decades to lure women, young people, communities of color, and more recently, the LGBT community into addiction and premature death. 80% of young people who use tobacco started with a flavored tobacco product. But perhaps the most egregious example is the decades of deliberate predatory marketing of menthol cigarettes that the tobacco industry has inflicted upon the Black community, contributing to African Americans having the highest rate of lung cancer incidence and death of any ethnic group. And more recently, the industry has very strategically used flavors to reverse the decline in youth tobacco usage with the lure of new tobacco products and candy flavored products, resulting in what the CDC has labeled as a youth vaping epidemic. And I don't want to steal any more thunder from Doctors Yerger and Halpern Felsher, so I will leave it to them to expound on those two topics later. So if we could move to the next slide. Since 2014, there's been a growing movement, primarily in California, to adopt local laws to restrict or entirely prohibit the sale of flavored tobacco products. Currently, 105 cities and counties in California, with a combined population of more than 9 million people, have adopted such local ordinances. In the beginning, some excluded menthol cigarettes, as the US Congress unfortunately did when it passed the Family Smoking Prevention and Tobacco Control Act of 2009, which prohibited the manufacturing of all flavored cigarettes except menthol. But more recently, tobacco control advocates and public health advocates have been successful in getting jurisdictions in California to pass strong local ordinances with no exemptions for menthol cigarettes or anything else. Of the 105 ordinances, 72 apply citywide and have no exemptions. Some of the examples include the cities of San Francisco, Oakland, Sacramento, and the county of Los Angeles. We're also having some success in getting cities that originally exempted menthol cigarettes to revisit that exemption and move to include menthol cigarettes in their flavored tobacco bans. A bit less than a third of the jurisdictions that have enacted restrictions on the sale of flavored tobacco products do exempt menthol or hookah or adult-only tobacco stores, or some combination of the three. And in the last year, the hookah industry, in particular, has become a very effective lobbying force and has increasingly succeeded in winning exemptions. Next slide, please, Norma. So the momentum generated by the passage of all these local laws was instrumental in the success we had last year in passing the state law, signed in late August by Governor Newsom. This was probably the most significant tobacco control law passed in California in the past 4 years. And here's a picture of the virtual signing ceremony with the governor there on the bottom row, second from the left, and your three panelists and many familiar tobacco control faces scattered about. California was just the second state to adopt a ban on the sale of flavored tobacco, having been just beaten out by Massachusetts. So congratulations to those of you from the Bay State. At a time when many states were considering bans on e-cigarettes only, this bill was significantly more comprehensive in that it included not just flavored cigarettes, but menthol cigarettes. and also flavored cigars, chewing tobacco, and other products favored by young people. Unfortunately, we were not able to fight off a narrow exemption for flavored hookah sold for on-site consumption, nor for premium cigars and pipe tobacco. But fortunately, in California, the tobacco control laws provide a floor and not a ceiling. Cities and counties are able to enact local laws that are stronger than the state law. For cities and counties with flavored tobacco bans that include hookah, premium cigars, and pipe tobacco, the sale of those products will remain prohibited. Jurisdictions without local flavored tobacco ordinances will be able to adopt laws that go beyond SB 793 and prohibit the sale of those products exempted by SB 793. And best yet, for those cities that elected to exempt menthol cigarettes in their local ordinances, the new floor provided by SB 793 means that menthol cigarettes will be taken off the shelf in those jurisdictions, just like everywhere else in the state. All of this was supposed to go into effect of January 1st this year. Unfortunately, it hasn't worked out that way. We can have the next slide. No sooner had the ink from the governor's signature dried than the tobacco industry embarked on a massive effort to do everything it could to stop the law. Within a couple of weeks, the industry had filed paperwork to launch a referendum and began collecting the signatures it would need to qualify it for the ballot. Soon thereafter, R.J. Reynolds and Philip Morris filed suit to block the January 1 implementation of the law. When it became likely that the referendum effort might qualify, the state attorney general agreed to stay implementation of the law pending the result of the effort to qualify the referendum. If the referendum effort failed to qualify for the ballot, the law would go into effect immediately. If the referendum did qualify for the ballot, the law would be stayed pending the voters' decision at the next general election. So after spending $20 million for paid signatures, the industry was successful. The referendum officially qualified and was certified by the Secretary of State to appear on the next general election ballot. And by the way, I should say that we will be working for a yes vote on that referendum. The voters actually become the legislative body and decide whether or not the bill goes into effect. So a yes vote will mean that SB 793 will be allowed to go into effect. This was supposed to happen in November of 2022. That meant at the very least, the industry would be successful in delaying the law for at least 2 years. But the effort to recall Governor Newsom has added yet another layer of uncertainty to this process. If the effort currently underway to collect enough signatures to qualify the recall for the ballot qualifies, that will trigger a special election, and the referendum would appear with the recall questions on the same special election ballot. Next slide. We won't know for a couple months whether the recall will qualify, but based on the number and the validity rate of the signatures that have been submitted to date, it appears likely that it will qualify. Yet there is surprisingly little certainty about when such a special election is going to take place. There are parameters in state law for a series of steps listed here that provide some wiggle room. If you do the math, it takes you to maybe October of this year, but a lot of insiders seem to think that it's more likely to take place in November. However, there's also the possibility that the democratically controlled legislature and the governor might find it in their best interests to pass legislation to adjust these timelines and push it back further, and maybe directly set the date for the election, perhaps putting it off until the primary election of June 2022. We just don't know at this time. So stay tuned. And thank you. So that's where we stand now, and I'll turn it back to you, Norma.
Okay, thank you very much. And if you have questions, maybe we'll have a minute or so at the end to take a couple. Let's move to the next panelist, please. That is Valerie Yeager.
Thank you for inviting me to participate in this discussion. I wanted to thank you, Norma, for setting the stage. You know, I see you. I have very similar traumatic stories that I rarely disclose. So thank you for highlighting the trauma that unfortunately touches so many of us from groups that are struggling to survive amidst the number of inequities that affect us. So whether it's a statewide SB 793 or local policies banning the sale of menthol, and other flavored tobacco products, or the addition of menthol to the Family Smoking Prevention and Tobacco Control Act's list of prohibited characterizing flavors, there are implications for all of California's priority populations. So for today's talk, I want to spend a few minutes to focus on the African American community, as I've been asked to do. It is my hope that lessons learned from working within the African American community will inspire and inform efforts that can be tailored for the needs of other vulnerable groups. And I realize I'm addressing clinicians and cessation professionals, but allow my presentation to widen your perspective related to some of our most vulnerable groups. I'm reminded here, as we're all still meeting virtually, that COVID-19 has unveiled just how much African Americans and other population subgroups in the United States have suffered disproportionately. And as we heard from Dr. Fiore earlier today, there are groups that need additional attention to help them quit smoking. Eliminating the sale of menthol cigarettes and other flavored tobacco products is a low-hanging fruit. Since 2013, as local policies to ban these sales have been popping up across the country, members of the African American Tobacco Control Leadership Council, specifically myself, Carol Magruder, and Phil Gardner, who I know are present with us this morning, we've all been intimately involved in a number of these efforts. Through the SF Can initiative, we worked very hard to get San Francisco to become the first locality in the country to pass a comprehensive law to ban the sale of menthol cigarettes and other flavored tobacco products. And since San Francisco, there have been 82 other localities, of which Jim pointed out 72 of those are here in California, with comprehensive jurisdiction-wide flavor bans. And there are still others with flavor bans that have exemptions, but even some of those have been amended to be inclusive of menthol and upgraded to a jurisdiction-wide policies. So the flavor ban work has resulted in a massive amount of relationship building with non-traditional partners, which I will talk about a bit later. My project, The Loop, has been funded by the California Tobacco Control Program since 2014 to deliver trainings and to provide other tailored assistance that are generally responsive to requests from CTCP, the California Tobacco Control Program's funded grantees who seek help related to California's priority populations. The California Tobacco Control Program has declared the end game for the state by the year 2035. Policies to get menthol and other flavored tobacco products out of the marketplace requires that we engage the very groups that are disproportionately harmed by these products. So though we have documented how policies are effective at helping people to quit smoking, our vulnerable groups are often self-medicating. They're using nicotine to cope with their stressors. And these groups are under siege, excuse me. These groups are under siege of a number, by a number of social, economic, health, and environmental inequities. So commercial tobacco control must go beyond tobacco control to consider the demand side of this epidemic. So evidence must be relevant and presented in a way that is responsive to the needs of the community if it is to be impactful from the community's perspective. We also need to invest our time and resources to buy time and space for that community to understand the relevance of the evidence. And it should be presented to community stakeholders in a user-friendly form. In other words, stakeholders must take ownership of any information that applies to them so that they can then use it to inform impactful policies, as policies may not be one size fits all. So the tobacco industry, in the case of African Americans, knew that the sales of non-menthol cigarettes were declining as more educated and affluent population groups were no longer smoking at the same rates. The menthol cigarette market represented a sustained growth and profit for the industry. And we had documents after documents that revealed how the tobacco industry was going to help sustain itself by marketing menthol cigarettes, particularly to Black people. So I'm not going to go over all the evidence, but I wanted to point out that the evidence that we gathered to show the pervasive presence of the tobacco industry in African-American communities is very helpful when talking to a community that is disproportionately burdened by the tobacco industry's products. And work that we did at UC San Francisco helped us to show that tobacco companies wanted to become a special kind of friend to community influences within the African-American community. And they also wanted to keep Black people smoking. But we were also able to document two other not so obvious motives, which come into play as we're working on creating and implementing policies. We know that tobacco companies have use their financial resources to pay Black organizations and their leaders to act as front groups, to assure and build support for industry policy positions, and to basically interfere with our tobacco control efforts that are stemming from within our communities. We were also able to show that starting in the 1980s, the major tobacco companies started to compete amongst one another within African-American low-income communities. And this is a once confidential document from Lorillard, which at the time was manufacturing Newport cigarettes. And we can see that even today, Newport is now the #1 menthol product, primarily because of these racialized menthol wars that went on in African-American communities. We were able to show how the industry implemented innovative tactics to penetrate these low-income communities, very often coming in with moving billboards, is what we call these vans. The vans allowed tobacco reps to go deeply into these communities that they considered as unruly and living in dangerous territory. And I show this to help explain why it is we saw an increase, a very quick increase of use of menthol cigarettes among African Americans. When talking to African Americans, having this historical perspective of the predatory marketing of menthol cigarettes in their communities is very helpful if we want them to establish a different type of relationship with the products that they've been using to help them cope. And then just in comparison with other groups that are using menthol cigarettes, we see that even still African Americans disproportionately use menthol. So we use both scientific evidence and also the tobacco industry's own words to engage communities in this fight. And it helps us to develop tailored messaging to these communities. However, there's one key point that always rises above any others, and that is that menthol is a social injustice. So it's important to frame the impact of menthol as a relevant and urgent public health issue. And the primary reason why menthol cigarettes are disproportionately used by African Americans and other vulnerable groups is because these products were systematically and systemically dumped into our communities. So through menthol, by framing it as a social injustice, we get vulnerable populations engaged. And no matter what we do in terms of policies, we have to consider how to help smokers quit. So we also have to get them on board before we go into their communities to implement policies. And we have to show them how to stay engaged even after the policies have been implemented and those of us who were working to implement those policies have left and gone on to another location. And so we are beginning to talk more about tailoring approaches to smoking cessation. I've noticed that become a bigger part of the discussion over the recent years. But what does that actually mean? So members of our disadvantaged population subgroups are faced with a number of inequities that adversely affect them. And so stressors come in the form of racism and other types of discrimination, persistent poverty, inadequate housing, lack of access to quality health care, just to name a few. And these social injustices undermine one's health and the well-being of one's community. Racism is a public health issue and must be addressed if we are going to have an impact on this commercial tobacco epidemic. So smoking is a coping mechanism many individuals use to deal with their perceived and actual stressors. The tobacco industry has exploited this demand, if you will, for relief. The paper Ruth Malone and I published a decade ago documents the racialized menthol wars that I referenced earlier. But those menthol wars have really fostered the tobacco-related disparities that we see today. So there's this huge elephant in the room that we just have to address, racism, but also homophobia, sexism, discrimination. And so the question gets asked, how do we tackle this elephant? And I suggest, as has been suggested by others, that we do so one piece at a time. And so as we are looking at this elephant, we begin to see that there are various domains that we need to engage with in order to deal with the inequities and injustices that contribute to one's smoking. We've already, spoken about healthcare, but also transportation, employment, environmental, educational, political, housing, criminal justice. These are just some of the many domains. Community-based organizations and advocates and volunteers, anyone who has any sort of expertise or interest in one or more of these domains becomes a vital partner for the work that we're doing in tobacco control. So whereas these organizations may not at all be focused on tobacco control, they're already in the community providing services to and building relationships with the very communities and population groups that are disproportionately burdened by tobacco. And so it will take time, maybe even years, along with a lot of committed effort and resources to engage with these community-based organizations. But if I had the time, I would go into the specifics. Just know that the work is going on involving large groups such as the NAACP and Delta Sigma Theta Sorority Incorporated. Both of these are large national African-American organizations. So we know that these highly engineered tobacco products containing menthol have been predatorily marketed and are disadvantaged groups, and that these are the groups that have higher smoking rates. This man, for example, with a cigarette in his hand is someone who will be affected by any of the policy work that we're doing. I don't necessarily see him wanting to engage with us in this work, not at this time, given that he's struggling just to make his basic needs. But I do see others who could come in contact with him, perhaps providing social services, medical treatment, even law enforcement. These individuals working in other domains are likely non-traditional partners. And also I want to remind us that many of us don't actually identify as being part of just one population group. Instead, we may straddle many groups. So in creating strategies to address how to engage with particular population groups or communities, we must consider possible intersectionalities. And so partnerships can be developed whenever and wherever there are opportunities. The key is to be strategic in how tobacco control is introduced, as other inequities and injustices are likely to be a priority for organizations that may not necessarily have the capacity, resources, or bandwidth to do more than what they're already doing. But it is becoming more common to see organizations that are addressing another domain sitting at the table with those of us who are doing tobacco control and focus on helping the most vulnerable groups to quit smoking. So I think that we are definitely headed in the right direction. I just wanted to just acknowledge that there are a number of considerations that go into helping vulnerable groups, members of vulnerable groups who are smoking, to help them quit. We not only need to be culturally competent, but we also need to be community competent. And for me, what that means is that you have individuals living within a community who may come from different racial and ethnic backgrounds, but they're in the same environmental space, being exposed to the same pervasive tobacco presence that we see in some some communities that have low income. And also we need to look at how to tailor any sort of stress management that we provide to these smokers. As I said before, it is a multi-domain issue for many of our hardest hit smokers. So to summarize, I want to just really remind us the importance of engaging the priority populations in a way that empowers them to take ownership of the information. And that means recognizing that we need partners in the community who might actually have other priorities. So we must then find common ground by integrating health equity and social injustice frameworks into our conversations as we build relationships. And it could take time. It will definitely take resources such as funding, but let's continue building the evidence for what works for the various priority populations, especially our population subgroups. And when developing policies, we must make them comprehensive so they include those products that are disproportionately being used by disadvantaged groups. And putting an end to the pervasive presence of the tobacco industry and its products in low-income communities is only part of the work that still needs to be done. We must also address the demand side of the commercial tobacco epidemic. And then I didn't really talk about it, but I do want to give a shout out for the need to have media education campaigns that can be used to raise the urgency of why tobacco is an issue for our most vulnerable populations. And with that, there's my contact information. And again, thank you.
Thank you very much. Next, Dr. Bonnie Halpern Felsher.
Well, hi, everyone, and I'm so delighted to be invited to speak with you today about vaping and youth and young adults. So just want to give a special thanks, shout out. We are also a recipient of TRDRP funding as well as a lot of other funding, and just very appreciative. Just a quick disclosure, especially since this is a CME event, that I am an expert scientist in some e-cigarette litigation. And as Jim Knox said, I do some policy work as well. So let's start with the e-cigarette products and rates of use amongst youth is what I'm going to be focusing on. So you probably are aware of the various e-cigarette products that are out there. And I'll tell you, these are growing almost daily. We're hearing about new products, new designs, new ways of implementing nicotine into a young person. And teens are very attracted to this, and that's what we're going to talk about. So certainly you have the older e-cigarette products more in the top right, the cig-alikes that look like a cigarette. Teens didn't use that a lot, or the mods, or the tanks and the vape pens. But then came along at the bottom left, Soren, the bottom right, Juul, and the top left, puff bars. And these are the newer products that youth are very attracted to, and we'll talk about that. If you're not aware, the older devices that people are still using, use an e-juice or an e-liquid. You can see pictures here. These are small, the size of an eye drop, what you find in like eye drops, and they contain the constituents, the nicotine, and the flavorants in them. One of these bottles is so highly concentrated with nicotine, or the nicotine itself is so highly concentrated that one bottle can kill an entire class of kindergarten kids. A teaspoon could kill an adult, a small adult. That's not for all, but a lot of them. That's how concentrated the nicotine is in these products. So let's talk about rates. The good news, and we heard this from Dr. Fiore's talk earlier this morning, is what we see on the left. And these are from the National Youth Tobacco Survey from 2019. And you can see the rates on the left of cigarette smoking for adolescents in high school has gone down dramatically across the country, and particularly in California, we're well below 10% of adolescents reporting cigarette use. That's the good news. What's not the good news is what we see on the right. The sharp increase in the number of adolescents who have started and are continuing to use electronic cigarettes, or vapes, as they may call them. So we see, particularly from 2017 to 2019, an increase. And we saw over just a 1-year period, a 78% increase in the number of high school students reported using e-cigarettes in the past 30 days, and 48% increase for middle school students. In 2019, the levels were at 27.5%. But I want you to look at 2018. That's 20%. That's the point at which the Surgeon General and the then commissioner of the FDA, Dr. Gottlieb, said that we had a vaping epidemic amongst our youth. Now let's look at the newer data. The later data in YRBS, the Youth Risk Behavior Survey that came out, also showed similarly high rates of e-cigarettes relative to other tobacco products. But I want to show your attention to the National Youth Tobacco Survey data in 2020. Now, these data came out and very recently. They were collected. This is a school-based survey. They were collected from January through March of 2020. After that, of course, schools were on lockdown, so we don't have continued data. Those rates are showing a potential decline, close to about 19.5% of high school students reporting current or past 30-day use. So the numbers seem to, or maybe going down. That's great. But I want to draw your attention again to the fact that those numbers are still where we were in 2018, where we said that we had a vaping epidemic. Not only that, this represents 3 million youth and 500,000 middle school students. So 3 million high school students. What's particularly concerning is that we're seeing a dramatic increase in the number of students who are saying that they're using these products daily or 20 of the past 30 days. So there's a lot of addiction going on. So what's in these e-cigarettes? I don't have time to go into all of this, but just to show you some quick, depending on the e-cigarette device you're looking at, the constituents are not that different from what we saw in cigarettes. Now, some of these are what's put in the e-cigarette. Some of these are the byproducts after they've been heated and what comes out of the aerosol. But the point is, we still have lead and cadmium and formaldehyde and a lot of other ingredients, not as many, but a lot of the ingredients that we've seen with e-cigarettes. And what I do want to point out one more thing is that the type of nicotine that's in these products is a salt-based nicotine in the newer products. Salt-based nicotine, that uses salt or benzoic acid to be able to bind to the nicotine, allow it to go into your body and into the brain very quickly. It doesn't have a throat hit. It's very smooth. Teens say, I like it. For a nicotine naive youth, which by the way, most teens who are using e-cigarettes today started with e-cigarettes. They did not start with cigarettes. As Dr. Ferrari was saying, it's not a cessation device for adolescents. They're starting with these products. Part of why they're starting is they don't mind the nicotine. It doesn't hurt like a cigarette was, doesn't have that throat hit. Cigarettes and the older e-cigarettes have a free-base nicotine, which has that throat hit. So that's part of why they're using these products so much. I also do want to make it clear when we talk about nicotine that, and there's a lot of statements that go on in the pro-tobacco and pro-e-cigarette groups that, wait a minute, e-cigarettes are not tobacco. They are tobacco. E-cigarettes, Juuls, all these contain nicotine. The nicotine comes from the tobacco plant. These are tobacco products. They are regulated by the FDA as tobacco products. And in fact, e-cigarette companies want them to be regulated that way because it's a lower bar than if they go, for example, as a cessation device. We could talk about that if we have time. So how much nicotine are we talking about in these products? So I'm sure you know, a pack of cigarettes has 20 cigarettes. What you may not know is that each cigarette has about 8 milligrams of nicotine. But what you take into your body, or the yield, is closer to 1 to 1.5 milligrams of nicotine. Because while cigarettes are super great at delivering nicotine, It's still not always efficient in that. A lot of it goes in the air, on the fingers, or ashtray or whatnot. So a pack of cigarettes has roughly 20 to 25 milligrams of nicotine if you just do the math in terms of what you're actually inhaling. Juul Pod, which is the most popular brand for teens overall, that they say they have 41 milligrams of nicotine. And Juul says, or used to say, they took it off their website, hey, you get at least 80% of what's in our pod into your body. So 41 milligrams of nicotine, if you just do the math, you're looking at, well, Juul would say one package of cigarettes, the nicotine found in one pack of cigarettes. We and others have said, it's closer to 1.5 to 2 packs of cigarettes. Whatever it is, that's a huge amount of nicotine in one pod. When you look at puff bars, we're looking more at about 50 cigarettes, and Soren has a greater capacity, greater yield. You're looking at more. The point is here, all of these newer salt-based nicotine products contain a huge amount of nicotine. When we ask teens, how many pods are you using? First of all, a lot don't know, and part of that has to do with the packaging that I'm going to show you later, and that they're sharing their products. But those who do say, especially those who are addicted, I'm using somewhere between 1 and 4 pods a day. That's between 1 and 8 packs of cigarettes worth of nicotine, depending on how you do the math. Huge amount of nicotine these young people are using. So why are we concerned? If I haven't convinced you enough, one is we know that adolescents and young adults' brains continue to develop until the mid-20s. That's great. When we talk to teens, when you're talking to teens, that's a fabulous thing. It's why they're so creative. They can learn language and music and do so much. But the problem is, look, we're all born with the nicotine receptors. We're all born with the ability to become addicted. But what happens is the body during adolescence and young adults is saying, what are the neuronal connections I don't need anymore? What can I prune away? And what should I keep? Well, if you wait and don't introduce nicotine into your body until you're in your 20s, your body says, great, I probably don't need that nicotine receptor, and it goes away. If you introduce the nicotine when you are in your teens or early 20s, your body says, oh, I need that nicotine receptor. Great, here I am, and keep adding the nicotine to it. So nicotine actually rewires and changes your brain. We also know that the nicotine in particular makes the heartbeat faster, not just for teens, for anyone. And then trouble breathing and damaged lungs. Let's talk about that. But first I want to say, we know that 90% of adults who are smoking or using tobacco now say that they started when teens. You cannot have better evidence of the addictive properties of this product and why the industry is constantly targeting young people, because then they know that they have a lifetime of addiction. So let's talk about the lungs first. So, and when the next panel talking about COVID, we'll talk about this more. So I'm only going to do this briefly, but we know that tobacco influences the lungs. It causes inflammation and irritation of the airways, just hurts the sacs and weaker immune system. We also know that the flavors that are in these products, in these e-cigarettes, diacetyl, which is the buttery flavor that we often see in popcorn, or vanilla, or cinnamon, the flavorants themselves can cause damage. Look, when you take a flavor, you can eat it. You can heat it like butter. You can heat it and eat it. But you heat it to 300, 400, 500 degrees and then inhale the aerosol that results. That's where we're having damage. And that's important to know. So again, they're going to talk about this in the next session, but I just want to show you that we did a study that showed that teens who were adolescent and young adults who were smoking and or vaping were significantly more likely to come down and be infected with COVID. We don't know if it's lungs in that study. It could be the hand to mouth. It could be teens are sharing their vapes. It could be that's how they're getting it, but we know that the exposure is there, and we need to talk to youth about not only brain damage, but lung damage and lung development that we need to protect. We also know that teens who are vaping, again, initiating with vaping, are 4 or more, depending on the study, 4 or more times more likely to then move over to use a cigarette and to use both. So we see a lot of dual use with adolescents. So why are teens using? There are a lot of reasons, but I'm just going to go over a few very quickly. First of all, flavors. We just heard two parts about the importance of flavors. I want to bring this to youth as well. Teens tell us, look, the flavors mask the harsh taste of the tobacco. It masks the smell of them. It masks the risks. Hey, if it tastes good, it must be okay. And teens tell us that they're more likely to say that they're interested in trying a product because of the flavors. Youth report that they would quit using if the flavors were not available. And the ads and the packaging, which I'm going to show you next, show how incredibly appealing these products are to teens. And by the way, youth are looking for flavors in any product. So if you take away the flavors in one product, they'll move over to another, especially if they're addicted. That's why we need comprehensive flavor bans. So what are the vape flavors? Think, you can even put it in the chat, how many flavors you think there are in e-cigarettes across the board. Here are just a few of them. Take a second in your head to think how many there are. And I will tell you in the interest of time, there are over 15,000 unique flavors in e-cigarettes. Not in all the products, but in a lot. So there are a lot of pro-tobacco folks in the industry who say, oh, no, we need these flavors to help adults quit smoking. Well, first of all, as we said, as you heard earlier, there's mixed evidence whether e-cigarettes actually even help adults quit. But I'm talking about youth. For youth, adults don't need honey doo-doo or sugar burger or unicorn poop or dragon's blood to quit smoking. These flavors are attracting young people. That is what is happening right here. And I want to get to the menthol and mint that Dr. Yeager talked about so beautifully. This is a slide that I got from a wonderful colleague at UCSF, Dr. Jeremiah Mock, who does a garbology study. He goes in and looks at the garbage in schools. This was pre-COVID, of course. Look at, these are jewel pods for the most part. The green colors, these are mint and menthol. Teens are using mint and menthol. So when you're looking at and advocating for flavor bans, it's important to continue to realize that it's not just adults, it's not just people of color or priority populations. Youth are included in that priority population. So easy to hide. Again, I encourage you to just quickly look. You can put it in the chat for fun if you want. How many e-cigarettes do you see here? And I'm going to give you the answer in the interest of time. There are 6. You can see how incredibly easy it is. And I get parents who come to me all the time and say, Bonnie, I didn't realize that my kid was using it until suddenly I realized what was in the bottom of the backpack or the laundry was this plastic device. And they finally realized that it was a jewel pod or a puff bar or something else. You can see again how incredibly small these products are. Teens tell us, we just published a paper on this, that they use because they're easy to hide. Marketing. I know this is flipping through quickly, but I want you to see that the problem with the marketing also, there are many, many problems. I'm going to start with one here, is that you get things like 4-pod multi-pack, 5% strength. What does 5% mean? Finally, Joe added nicotine, but these are the earlier packaging. 5% strength of what? What it is it's 5% nicotine. Nobody knows what that means. Nobody realizes that that's translating into 41 milligrams of nicotine. This is a problem that we see. And we also see flavors in the packaging. Again, these are meant to attract kids, not adults. Access, another piece. Look, local discounts, student discounts. Hopefully you know that in California and actually across the country now, as of December 2019, the law of the land is you have to be 21 to purchase, or you cannot sell a product to somebody under 21 is the way the law says. When you see a sign like this is attracting young people. The majority of students are under 21. And we just published a study that showed that most teens, or not most, but many teens, a quarter at least, were able to buy e-cigarettes online and in person without age verification. And when they were asked to show age verification, it was through IDs and online ways that are very easy to fake or get around. And finally, misperceptions. Adolescents just don't understand these products. They think that they're less risky. Well, are they? Jury's still out, but they're certainly not less risky for them when they're, you could say to a teen, it's not a fair comparison of cigarettes to e-cigarettes. It's a comparison of e-cigarettes to nothing, because that's what they're doing right now. In terms of addiction, it is definitely not less addictive for adolescents or anybody. given the high amount of nicotine that's in these products and the type of nicotine. So in summary, it's a perfect storm to addict our youth. They're using stealth and youth-focused products, very high levels of nicotine, a salt-based nicotine that has less throat hit, easier to use for young people. Teens don't understand the misperceptions that they have about nicotine and harms. And by the way, teens don't understand addiction. When you say you could become addicted, they say, yeah. Say, so you can quit tomorrow? Oh, easily. They don't understand what addiction means, which is part of the problem with the FDA mandates of saying these products are addictive. We need to explain it to teens. We've got misperceptions, flavors, packaging, and they're cheap, all together harming our young people. So to end with some resources and what you could do. So whether you're a healthcare provider or a physician or a clinician or whatever you are doing, talk about tobacco, talk about e-cigarettes. Teens told us in another publication, by the way, I didn't provide a lot of references, email me, I'm happy to provide documentation and references. But teens say, look, if you don't talk to me about it, I assume that it's fine, that it's safe. And that's true with all drugs, not just nicotine or tobacco. Don't smoke, don't use these cigarettes around youth. We know about the secondhand effects. Encourage your parents, encourage your youth to talk to you, and encourage everyone to talk to providers to help youth quit. And if you are using an e-cigarette, or if your patient's parents are, keep it away from kids, especially because it smells good. And we know of little kids who have been drinking some of that e-cigarette solution and getting really sick from it. So lots and lots of resources. Unfortunately, as we said before, we don't have FDA-approved nicotine replacement therapies or any pharmacological agents for youth. There's just not good studies out there to show that they're effective. So we need to work around and use other resources. I'm just going to spend my last 45 seconds or so showing you a couple of the resources we have. Some of you may know the Tobacco Prevention Toolkit. By the way, these are free. I'm not selling anything. They're completely online. And we actually do free trainings on using these. So the Tobacco Prevention Toolkit and the Cannabis Awareness and Prevention Toolkit are particularly for schools, but we have healthcare providers and other using them, and they focus on vaping, nicotine and vaping, cannabis and other things. We will be launching a Visit. This is a new website coming out in the next month, and this is for healthcare providers to give you 30 seconds of information, 30 seconds of resources to help talk to your teens about, and your parents and others about all tobacco products. And we will, somebody said in the chat about the 5 A's. We talk about 5 A's. We give you resources and we give you cessation information. We have a remote learning curriculum on there. We have a Healthy Futures. Our philosophy is don't suspend, don't punish. If you catch a young person using, let's help move them towards quit. So this is our Moving Towards Quit program that we have. And we also have a social justice program on there that actually Dr. Gardner helped us create. So I want to thank you so much, and I'm happy to answer questions if we have time.
Thank you so much. There are questions in here. There was one that asked about ASAM criteria. Let me see if I can find it, because I think that's really important in terms of folks being able to participate in substance use disorder programs if they're paying for smoking cessation. What percentage of teens who vape meet ASAM criteria for addiction? Anyone on the panel might know?
So the criteria for addiction has changed, and actually I would love if some of our clinicians would chime in on this, Norval and Joe and others. But you know, the criteria for addiction has changed, and particularly for youth. Youth don't have to, and youth often are not using on a daily basis to become addicted. We know some teens who are just using on weekends, but they're addicted. But there are criteria in terms of, you know, use it when you wake up, that you use it even when you know you're in trouble or when you don't have money, that it is something that you're thinking about. It really consumes your time and your thinking. Others want to chime in.
The e-cig equivalents for the cigarette equivalents for e-cigs are even bigger than what Bonnie was saying based on nicotine content. This is from Dr. Glantz. because a lot of the nicotine in cigarettes ends up in side stream smoke rather than the smoker's body. E-cigs don't produce side stream smoke.
Question that I sort of alluded to. So with your great, beautiful slides on how much nicotine is in e-cigarettes compared to regular cigarettes, should we reassess the question that regular cigarettes are worse than e-cigarettes?
Oh,
So much higher amount
That's-
of nicotine, and
Yeah.
e-cigarette users, are you using them constantly while cigarette users usually put them down and they burn a cigarette, it stops?
Yes, they do. Yes, they do.
You're right. I mean, this is a generation with teens, and I'm going to come from a teen perspective, not an adult perspective. For teens, absolutely. And for teens, it is the first generation to be able to use these products 24/7. We talk to teens who say in the middle of the night, I get up and if I can't sleep, I look at my iPhone. They get up and they take their hits because they can, particularly the newer products, they can use them under their, put them under their pillow and take them in the middle of the night. And moms and dads and caregivers don't see what they're doing. It smells. I always tell people, look, if your kid's room smells like bananas and grapes and blueberries, I don't think it's fruit salad. I think you may want to be concerned that they're using a vaping product. So yeah, it is. And as my wonderful colleague, Dr. Brian King often says, for a teen, are you talking about jumping from a 10-story building or a 15-story building? It's kind of the same outcome. So it's really hard to say, but for teens, they are using e-cigarettes and we're really concerned about it.
Okay, this is one that's directed at Jim Knox. Can you please talk about AB 422 and provide information to this group why PUP laws aren't an effective strategy, in particular because some PUP laws may include cessation programs for youth, but really PUP laws are not the way to go.
Absolutely happy to. This was a bill that was introduced by a normally supportive legislator earlier this year. It would have allowed cities to impose educational requirements and be able to confiscate tobacco products in the hands of those underneath below 21 years of age. The data on youth possession laws is that they are not effective. They introduced a very dangerous criminalization component. So we and all the tobacco control groups fight very hard against imposition of these PUP laws. We don't think it's the kids that should be punished. It's just the retailers that ought to be subject to penalties. We were able to talk to the legislator who introduced the bill, and Phil Gardner, I think, was part of that, an instrumental part of that conversation. And the legislator has now decided to park that bill and not move it this year. So we were able to push back that effort, but this is something that goes on not just at the state level, but in communities around the state. We're very active in trying to avoid implementation of youth penalty laws and to try to get rid of them where they currently exist.
And this is Valerie, if I can add something to that discussion. It strengthens the industry argument, the argument that is used by industry front groups, like some of our African-American leaders that we know are tied to the tobacco industry, are taking tobacco industry money to basically interfere with our menthol flavor ban efforts. It strengthens their argument that these policies will increase the criminalization, especially of Black and brown males. So it's very important that we do all that we can to make sure that these PUP laws do not get implemented, that they do not even get discussed as an option.
Great. This is a wonderful, wonderful panel. So much information. And one last little thing that might be kind of a food for thought or something for us to keep thinking about. Dr. Shannon Kozlovich says, it all changes so fast. How do our policies and regulations keep up with such a rapidly changing market? Something that we just keep chewing on and keep working towards, and chasing sometimes it's like the horse chasing the cart, trying to keep up with all this stuff. So thank you for a wonderful panel. Thank you so much.